very sad story. A nurse lets a 3-year-old child die under her care, admits that she was on meth. Let's put a picture up full of mass, the custody picture. Okay, she's a nurse. That's how she looked. She was on meth, okay? Her name is Judith Maria Sobol. She never should have been around children. She was taken into custody on Monday. She was charged with 1 count of 2nd-degree murder and 1 count of possession of methamphetamine. Sobol confessed that she, and I quote, shot up meth before coming to work and admitted that she was responsible for the toddler's death because she was not in the right state of mind to be at work and she should have never come to work at all. She allegedly had shot up each of her 4 days before the child's tragic death. And this is such a damn shame. This is so sad, okay? The woman has an addiction. But when you engage in that addiction, knowing that you are putting someone's child in danger of dying, there's a responsibility here. You got to take that responsibility. Let me give you the background to this story. Officers with the Coloma Township Police Department on June 20th, this was in Michigan, June 20th at approximately 2:30 a.m., responded to a 911 call about a child not breathing. Upon arriving at the scene, first responders found the child and both of the parents inside of the toddler's room. The father was reportedly performing CPR, but told police they were not sure how long the child had been unconscious. The parents, whose names have not been reported on record, told the officers that they walked into their daughter's room and found the little girl and her nighttime nurse, later identified as Sobol, both lying on the ground. They noted that the child's required breathing tube was nowhere to be found. Police said the victim appeared blue. Let's go to her LinkedIn profile, okay? I'm gonna do a comparison here because people have to be vigilant. Look at her LinkedIn picture. This is Ms. Sobol's. Her profile pic is dramatically different than her active in meth addiction image, okay? You mean to tell me you are a medical professional and you have clear signs that you are addicted to something? And I know it's not politically correct what I'm about to say, but use some common sense here. Do we have the picture, the original picture? Okay. In that original picture, look at her. If you walked into a hospital, if you walked into a hospital room and that person was taking care of your child, would you say something? Of course. If you are a medical doctor, if you are a medical professional of any sort, you are trained to notice symptoms, signs. You're trained to know them in patients so that you do not aggravate an addiction, an underlying addiction, or an aggressive addiction. The parents hired Sobol, a registered nurse at Forest View Hospital, to watch their toddler who had several medical conditions and required constant monitoring. Sobol would instead be found lying on the ground next to the child, mumbling. The cops found her in that condition. Let's put up a picture of the hospital that the child was eventually taken to. The child was taken to a place called Spectrum Lakeland Hospital for treatment. However, she died from her injuries and was pronounced dead approximately 4 a.m. The toddler's trachea tube wasn't located until after they arrived at the hospital, where it was found tangled up in her hair. Sobol, who allegedly had a container of meth and 2 pipes on her when she was processed, reportedly told police that when she cleaned the trachea tube, it likely became disconnected. She reportedly said she likely then passed out or fell asleep without the trachea tube being properly replaced. Completely completely avoidable. You can't blame the parents. They're suffering enough. But damn it, in all of the systems involved here, no one noticed this woman looks out of sorts. We're not even talking about the behavioral issues. If you are a meth addict, there are behavioral tales. The physical tales were prevalent. Now, a toddler is dead, a family is destroyed. They would never be the same. They may be able to cope, but they would never be the same. All right, Dan, thoughts here?
Yeah, it's just another one of those cases, and unfortunately we've covered them a lot on Indisputable here, where it's a failure of people who should be in charge to make sure that at bare minimum, you have tasked with making sure they're taking care of life, very vulnerable life, are themselves able to come to that job every day and take care of themselves and others. If this person looked that way when they were processed, how they looked that morning coming into the workplace, how they look before that. It's patterns that should have been seen, because the idea that you are taking care of a child and you're in some type of brain state like that to where you can't even finish that task before passing out, it's hard for anyone of clear mind to imagine. So hopefully she gets some help, but it's just too little too late, of course.
Well said.